Hi Professor, my name is Gitasprit Kaur. I'm going to perform the video on head to toe assessment. First I perform the hand hygiene and provide the privacy to my client. Okay, so can I get to know about your name?
Jasmeet.
Your date of birth?
15 Feb 1990.
Okay, Jasmeet. My name is Gitasprit Kaur. I am a student nurse at Seneca College. I'm going to perform the head to toe assessment as per doctor's prescription. Can I?
Yeah, sure.
Oh, do you have any kind of pain?
Yeah, it's headache.
It's headache. Is it aching, radiating to some parts, other?
Yeah, it's aching, not radiating.
Okay, how do you rate your scale from 0 to 10?
It's 2.
Okay, is there any need to call the physician?
No.
Okay, so now I'm going to begin with the neurological assessment. First I check for the level of consciousness of my patient. So Jasmeet, where are you right now?
At my friend's basement.
Okay, Jasmeet, what is the day today?
Monday.
Okay, how do you come here?
By my own.
Okay, Jasmeet. So now I'm going to check her symmetry of pupil. From this side. Okay. From this side. Okay. So now I'm going to check for the accommodation. So I'm going to point this like this. You do not need to move your head, only move the pupils, eyeballs. Okay. Okay, just me. Now I'm going to pour the light on your pupils. So do not move your head. Okay. Okay. So just me. Can you smile for me? Okay. Can you close your eyes? Close it tightly. Uplift your eyebrows. Okay. Can you stand up for me? So you do like this. I'm going to check your pronator drift. Count 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. Can you sit for me? For her neurological assessment, I find that she is fully oriented towards the time, date, and place where she is. Her pronator drift is negative, and for the pupil, the symmetry is equal, and for this symmetry is equal, and they are accommodating and reacting towards the light properly. So now I'm going to begin with the respiratory assessment. So as for the respiratory assessment, there is no any first I do the inspection. There is no any kind of protruded mass is present interior and posterior side. Now I'm going to auscultate her from as there are 10 landmarks interiorly and 18 landmarks posteriorly. So I auscultate from the interior side. I'm going to auscultate. Okay, just be calm and relaxed. Can you? For extraction and retraction, can you breathe in, breathe out? Okay. For the respiratory assessment, I have done with the respiratory assessment. There in inspection, I didn't find any kind of masses, protruded mass, and there is no any kind of bruises are present on her skin, and there is proper extraction and retraction of the lungs. I didn't hear any kind of crackles, wheezing sounds. I heard proper bronchovesical sounds. So now I'm going to begin with the cardiovascular assessment. As for the cardiovascular assessment, first I inspect. There is no any kind of bruises and are you in anxiety?
Mm.
Okay. So first I begin with the first intercostal space that is present in the right side, that is aortic. Second intercostal space, that is palmic. Third intercostal space, that is arabs. Fourth intercostal space, that is tricuspid. Fifth intercostal space, that is mitral, which is mid clavicle, is present mid clavicle. And here I'm going to listen for the apical pulse for 30 seconds. As for the cardiovascular assessment, I didn't hear any kind of other sound. I heard proper lub-dub sound and S1 and S2 sounds. So for the apical pulse, the rhythm is regular and it is non-labored, and it's 80 beats per minute. And for the inspection, there is no any kind of protruted mass and bruises are present on the skin. Now I'm going to begin with the abdominal assessment. Can you lay down for me? First I do the symmetry. Okay, so symmetry is equal and there is no any kind of protruted mass is present. Now I'm going to inspect you. There is no any kind of protruted mass and there is no any kind of lumps of the mass, and there is no any kind of bruises at present. Now I'm going to auscultate her from her lower right up quadrant. Lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. Now I'm going to palpate her. Lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. As for the abdominal assessment, I didn't hear any kind of hypo and hyperactive active sound of the bowel movements. I heard proper normatic sounds. And for the inspection, there is no any kind of lumps and the masses are present on. There is no any kind of masses of the skin are present on her abdomen. No any kind of bruises are present, and there is no any kind of pain is present here. So can you stand up for me? Okay, now can you please sit down? Now I'm going to begin with the extremities. So first I check with the carotid pulse. Now I'm going to check for the dorsalis pediis, tibial posterior, dorsalis pediis. I'm going to check her strength. Can you push back? Okay. Okay. Radial pulse, brachial pulse. Okay. Capillary refill within 3 seconds. Okay. Skin drift. Okay. No edema is there. As for the extremities, the strength of her for the muscles of the extremity is +5. I feel the carotid pulse and dorsopedius and tibial posterior pulse, they are non-labored, they are regular in rhythm, and there is no any kind of edema is present. And for the bony prominence, there is no any kind of pain is there, and no edema is present, and capillary refill is refilling within 3 seconds, and skin is fully hydrated. So I am done with my hydrodone assessment. Now I need to perform the hand hygiene and do the documentation and 360 degree of my room.